All right, so we're now recording. So let's begin. So we'll start. We'll first discuss familiarity with AI applications in clinical settings. So to ask, how would you define AI, and what comes to your mind when you think about AI and occupational therapy?
Mhm. Well, to begin with, I'm not really a very techie person, if I may say so. So as far as the definition goes, I'm not very particular, but perhaps I would consider it as something that uses technology, like more advanced technology than what we currently have, into generating materials that would be helpful or that would make everyday activities, or not really just activities, activities of each individual easier and more convenient.
So in terms of in occupational therapy, what do you think are the possible applications of AI in occupational therapy?
I've seen it used in documentation. I've seen it used in visual rehabilitation. So I think I've seen it used also in pediatric practice, but not the mechanics or tools per se, no? Parang mga ano lang, typically generating information, generating worksheets and such. Siguro the most techie stuff that I've done now with the visual rehab. So as you know, you invited me because I work in the pediatric setting, but a little bit of background would be I do visual rehabilitation, and I kind of do adult in that sense as well. So it kind of falls under FISBIS and adult practice as well. So I was reflecting when I was reading your interview questions, and perhaps what I could share tonight would be more of my practice and the visual rehabilitation for those adults who did use some apps and tools that we suggested so that we could easily help them improve their way of living.
Yeah, so can you share how you use AI po in visual rehab? So yun, we can go and transition right into experiences with AI integration. So do you use generative AI applications in your in your clinical practice? And if yes, what has the experience been like? And if not, could you share the experiences behind not using them? So since you also practice in pediatrics, something like that.
Mhm. Well, since I've mentioned that I'm not very particular, like I'm not the person who tries to discover new findings, new tools, ganyan. What I usually do is that I just follow what was told to me. So there were instances na whenever we do case studies for visual rehab, may mga na-introduce na applications and tools. So we have some tools like Envision AI. We also use see, I forgot the term. The Siri version of Samsung, parang that's one that I tried with a client before, with a person with visual impairment before. So we use the voice assistant of their phones, whatever phone they have, to try to allow them to communicate using phones. So yung mga ganon. And then the Envision AI, I think I've used it for a year, more than a year now. But if I remember correctly, the feature includes parang zooming in on a photo, or like describing verbally what would be the photo uploaded to the app. So mga ganon yung na-experience ko. There was also this thing na inintroduce sa akin, but I haven't tried it personally. There is this parang application daw that would allow the visually impaired or the person using the phone to parang communicate with another person who would then interpret whatever was in the environment. So it's in my notes somewhere, but I haven't tried it personally yet. Generative AI, if I got it correctly, if I understood it correctly, perhaps my practice would be uh generating worksheets, diba? Sometimes as an OT, I have this particular worksheet in mind. I want it to appear like this. but I don't know where to get those worksheets, those type of worksheets. Some there are free resources, pero sometimes wala naman ng ganun. So I've tried using that, yung mga Gemini, ChatGPT. I don't know if it falls under, but on top of my mind, it falls under our generative AI. And sa clinic, we also tried to create a short form of the evaluation form. So as you know, our documentation is kind of tedious. So very long yung forms, very hard to do, and it's honestly hard to deliver, diba? Especially when you're practicing, wala namang masyadong deadline, ganyan. So it has been a problem for us as a clinic admin na papers are not turned in. So what we tried to do was to use AI to kind of curate a short form, an OT, we labeled it as OTIE checklist. And it kind of worked because we gathered feedback from our therapist na it's easier to use, it's shorter. So we just incorporated what we want to appear on the form, and then but mostly it was what was generated was used na eh. We just added some information, decreased those are not relevant in our culture. So yon, so documentation also meron. Other than that, parang I can't remember of anything na.
So, would you say that aside from your work in visual rehab and with documentation, like for admin work, would you say that do you or do you not use AI on the daily, or how frequently do you think you use AI for your practice?
I don't know how we classify that, no? Because we generated the form once, pero we use it repeatedly. So siguro kayo na bahala how you would label that. But so technically, our short form version is kind of generated. In terms of frequency of using the form, doesn't happen very often naman. Siguro I do evaluations, I do take-ins of new clients. Siguro once every 6 months na lang eh. So it's not very often. At present, wala rin yung VI clients ko who I taught with the apps, the vision apps. So I can say na I'm using it right now. But if they are using it, I would say na I was able to teach about how to incorporate it in their everyday life. So hopefully nagagawa nila on the daily. But for the worksheets that I mentioned earlier, siguro once a week. I typically plan for activities kasi on a weekly eh. So I will just generate an activity sa start of the week, tapos I would just upgrade and downgrade it. So once I generate something, mostly duplicates na lang yan. So siguro safe to say, yung mga photos, images, worksheets, mga once a week naman yan.
So with generative AI as a whole, so you said that you use applications as well like ChatGPT and Gemini. So how do you think has generative AI impacted your role and clinical practice as an OT? Or in what ways has it not?
Uh, One thing for sure is that it made it easier for me to plan. It made it easier for me to decide to accept new clients because before hesitation would be ayokong gumawa ng report. It's a very hard activity or like I can't I can't take in clients because I have that time for the client care pero I don't have the time to do the report. And you know it's not a good practice to do diba? To take to intake tapos wala ka namang report na i-present. So it has parang given me a newer perspective na, okay, I can take in clients because I have shorter forms naman. And then, as for the worksheets nga, instead of doing manual worksheets pa, which would take longer time, so easier na siya. So, siguro, if I'm more equipped with generating stuff, minsan I struggle with that also. So, it's easier talaga. Definitely easier for me.
What do you think are like the areas that AI hasn't really made an impact into your clinical practice?
Not need an impact. Huh. Well, I feel like there's more to AI that I haven't explored yet. So baka dun sa area na yun, what could not be impacting my practice would be the things that I don't know yet. Kasi nga, I'm not the person who would try to search. Hindi ako ganun ka-inquisitive eh, especially with technology. I just follow. So for example, yun nga, may mag-suggest sa akin, you can do this here. Okay, I will try it. Pero since majority of the people I work with do not actually use AI also, so wala ako initiative also to search for what's out there. So dun siya nalilimit. Probably if I may say na the limited information of those I work with AI, with the use of AI, yun din yung nagiging limit on my part. Like similarly when we were teaching yung sa VI na apps, I would honestly say na I learned a thing or two dun sa intern na I was handling. Kasi siya, parang sinuggest ko lang na use voice assistant. But I really didn't know the particulars. And then, she suggested the mga stuff and then I just kind of listed down. So, yun, parang when I was exposed, I kind of knew what's out there that I can try as well. Pero, I feel like marami pang pwede. 'Di ba? Parang I may not know what generative AI is, but I'm definitely sure na it's more than what I currently know. Does that make sense? Parang ganon. So, yun yung feeling ko na limit to my practice right now.
So, what are your initial like feelings about the integration of generative AI into clinical practice? Like, would you say that there are factors that affect why therapists may not use it? So, for example, in your case, if you don't use it on the daily, like, what do you feel about the integration of generative AI?
I feel like ano naman siya. It's also a matter of limitations into what clinicians would know. Siguro yun nga, I feel like I'm not the only one naman who who doesn't know what's out there in terms of AI. So baka yun din yung factor kung bakit limited yung nagiging exposure. And in the Philippine context, I might siguro consider yung limitation of the resources, probably. Um, uh, I used to have practice in the province where there is limited opportunities for gadget use, ganyan. So, on top of my mind, siguro, even if I feel like my clients there would benefit from AI, baka hindi ko rin siya ma-recommend because wala, limited yung gamit, parang ganon. And then, siguro, there has to be a very big push because what we advocate right now, in the general, di ba, parang no screen time. Kaya that's what we tell parents eh. Pero kapag ka hindi mo kasi masyadong in-explain, would this fall under screen time? So baka ganun din yung naglilimit in a way na how would you really delineate the line between useful AI versus yung mga AI na parang baka mamaya maging overboard din naman na it's not beneficial anymore.
How about like as a therapist po mismo, like
Mhm.
um in terms of how you feel about your use and your fellow therapists' use of AI in the practice.
Like my perception?
Yes po, like siguro not in terms of the lens of the patients, but more of as an OT, like as an OT using AI. So how do you feel about that? And in terms of how you feel that other therapists are also using AI in their practice.
I'm not really sure if I got that right. But maybe Maybe ganun pa rin eh, because what I would recommend to my clients kasi is something na I'm sure they would be able to follow through at home correctly. Ganun ba yun? Na parang I feel like if I don't really know what's going on in the AI stuff that I might possibly recommend to my clients, baka hindi ko rin siya gawin if I'm not sure that they would be able to carry over the correct way that I would want. Ganun ba? I'm not really sure if I got the question right.
Yeah, yeah. Parang since yun nga, as an OT, since you said that
Mm.
you're not as the techie type to use AI,
Mm-mm-mm-mm.
then that if I understood correctly, then that influences as well both how you use AI and how much you recommend it to your patients as well.
Mm-mm.
Yes, okay, sige. Okay, so let's move on po to perceived benefits of AI in clinical practice. So, just to expound on what you said earlier, like what do you think are the potential benefits of generative AI in the OT practice, if any?
Um, I feel like ano naman siya, there is a potential to make the work easier for therapists. You know, our work allows us to parang our work is very prone to having burnout kasi it's very hard to think of your activities. And if if there's any way for our work for the planning to be easier, maybe AI could help that. So that could be a potential benefit I feel. And then the ease of your documentation, minsan that's what's lacking in the Filipino context din na parang, okay, I can make a report, pero who uses my report? If it's just a pen and paper type of report, di ba? I'm saying this because I talked to a colleague before na she's trying to do something like a documentation type of thing. And I'm assuming it's an AI thing also. And her vision, as she said, was to make the ano ba, the details of a client more available for everyone to use. Parang a database, I'm assuming. Parang ganon. So siguro that could be a benefit na whenever, siguro talking as a clinic admin, no, whenever we intake clients, sometimes meron naman na silang evaluation and other prior medical reports. But since we don't have access to it, we'll have to start all over from evaluation, ganyan, intake, which could have been easier if, ano na lang, readily available, then we can just continue. Ano pa ba? Other benefits would be in the pediatric setting, who knows, 'di ba? Baka mas makuha yung attention of the kids if we use more modern approach. Baka parents would also be more interested in receiving service. Kasi baka naman yung younger generation of the parents, which we do now have, would be more interested to try therapy na mas high-tech or mas modern yung approach versus yung mga simple na playing lang. Baka that's something also that would contribute.
So, do you think, based on your answers, how might these benefits affect patient outcomes and the OT profession as a whole?
Well, this one, I think I can't really answer it because personally nga, I don't feel like I've used it a lot. But in the pediatric setting at least. But siguro, I was quite satisfied when I introduced the voice assistant to my client before, to a person with visual impairment. We were able to achieve OT goals, 'di ba? And looking back, I feel like it would have been harder. It would have taken longer sessions if walang voice assistant. Kasi what we did was to just instruct, oh, how would you use voice assistant? Pero imagine if no voice assistant, if it was the old phone na keypad, we would have to really take time to teach tactile integration because he would have to type, memorize dapat niya yung keypad and everything. It would take a lot of practice. What we did for 2 sessions would probably take 10 or more sessions to do. So it was easier also. So in terms of the use, the impact, very high naman siya. And the positive also. Hmm.
Okay, so let's move on to ease of use and concerns about AI. So you said since you're not one to really use AI, so how do you perceive the collaboration between generative AI and OT connections? So, sorry, particularly in how easy or difficult it is to use the AI tools in the practice.
Bakit naman it would be easy if merong clear na what, 'di ba parang if it would come with a manual, if it would come with a specifics on how to do it. Like yun, always going back to what I experienced. If if wala din nag-guide sa akin on how to actually use the tool, baka hindi ko rin siya ma-perceive as easy. Pero when napakita naman na, okay, this one is easy. Parang this is how you do it lang. You just generate this, open this app and stuff. Parang I found it easy naman to use. So siguro, once you just get to know how or like what's out there, it kind of would be easy. Pero baka for some cases, depende siguro if we're talking about AI na very robotics and stuff. That I'm not sure if it would be easy pa rin to incorporate in the practice.
I guess in terms of have you tried like generative AI chatbots?
Oh, yeah, for the worksheets, for the other stuff. Sometimes, hindi ko alam kung personal thing na yun. I find it confusing because parang it doesn't give you what you want. So what keywords would you be using? Pero sometimes naman, it's kind of easy to generate. That's why I still try to use it. So in a way, easy. Like, do you want me to rate? Siguro 50-50 in that case.
So can you share about like your experiences like with the you said you have to be careful with the keywords that you need to use. So in terms of the use of prompts, like would you say you have a
Mhm.
difficulty with that when using AI?
Sorry, what do you mean?
Like for example, when you use like AI chatbots like the popular ones such as again ChatGPT, Gemini, like when you use those AI um chatbots, like you have to type in your like query or your prompt. So would you say
Mhm.
that that would be the difficult process for you, like finding the correct prompt into getting what you need from the AI tool?
Hmm. Yeah, in a way, yes. Like, for example, if what I'm looking for is a generic kind of worksheet, for instance, kind of easy naman siya. But if I'm looking for very particular ones, I feel like it's still hard. But then again, I'm not sure if it's parang beyond the capabilities of the AI na talaga or baka mali lang din talaga yung way of using ko. So, kasi ganun siya usually eh. Kapag ka very particular or specific na yung gusto ko, I can't seem to generate anything na that would be of use to me. Parang ganyan.
So at that point, would you be like the one na lang making the worksheets po?
Oo, that happens to me. Parang I would try, pero sige, wag na lang. Or at least I would still generate what was given, pero I would just add something. So in a way, it was helpful pa rin naman instead of doing everything from scratch. Pero hindi pa rin siya fully na-achieve yung gusto ko. Like I was expecting for it to happen.
Okay, so with that, like how do you feel about generative AI tools being used in the OT practice? So are you happy or worried about its integration or its potential integration into the practice?
Siguro this one, I'm still neutral. Like, I'm curious to know how it could be really integrated into the practice, but I'm also kind of worried if it would be used correctly. But I'm not saying this naman na very particular to AI. That's how I am with all new things integrated. Siguro my perspective would be my worry about the OT practice in the Philippines in general. I think it might go farther na from your topic, no, but this is where I'm coming from. I feel like here in the Philippines, everything that we introduce is kind of crucial, critical, because people needing the service would always try it with less precaution, if you know what I'm saying, diba? So, for example, we introduce a new or people hear a new service like there are other therapies people would try it assuming that they can use it to replace OT. I feel like it goes the same with AI, that if we really put it out there and AI is very accessible to everyone, that's my personal worry na it could be used to improve the practice of occupational therapy, particularly in the Philippines, but it also can also be misused into thinking na, sige, ito na lang gawin natin. Like parents would think na, sige, I will just search what I can do. And therapists might also do the same eh. Na, sige, I won't review my things na I won't need my seminars na I'll just go to AI. So that's very critical for me. I always advocate for our profession and wherever I go. So feeling ko lang ganun pa siya. So I'm not very excited yet because I feel like there's a very, very big possibility and tendency for it to be used in a wrong way. And it's something that we can't really control because it's out there. So parang it would be hard to create boundaries on how you can use it. It would really just depend. My worry would always be people generating activities lang from the chatbots tapos okay, ito na yung ita-target mo. 'Di ba? So for example, my client with handwriting problem, tapos yung therapist magge-generate lang ng activities for clients with handwriting impairment. Pero kasi as a notary, you really have to identify which area ba talaga yung nag-create ng ganun. 'Di ba? Siguro, what I'm remembering based sa question nito would be my experience with a parent na so I have this client na may problems with handwriting. And then nagulat ako, may pinakita siyang sa akin videos and activities nung child niya being gone by the SPED. Tapos ang comment doon nung SPED na, Mommy, nag-OT ba to si student? Kasi parang ako lang yung gumagawa ng OT. Tapos sabi ko, bakit mommy? Tapos sabi niya, ito daw pong activities na to ay dapat OT activity. And you know what? Meron lang siyang mga random activities for integrating reflex, whatever, whatever. And I feel like ganun din yung AI na parang if it's something out there, people would just go, okay, what can I do for handwriting without really tailor fitting it to the specific needs of the client. So yun, medyo parang going back to the question, baka neutral lang ako doon sa possibility na yan.
So with this, like you're saying na there may be a risk for like losing the client-centeredness in terms of how we provide the care if AI is misused. So how do you think these issues that you've mentioned could be addressed?
Mm, well, I'm not sure if it's possible to have parang a body of knowledge or like a set of people or group of people who can create, I don't know, some sort of manual siguro. I'm not even sure if that's possible, but siguro ganon. Or like to practitioners like me, di ba, na parang like I said, limited yung alam ko. So siguro if there would be more knowledge about it, how to properly use it, baka that would be something para ma-avoid din yung worries ko na baka it would be misused by therapists also. Because at least yun yung magiging control natin eh, yung use of therapist. The parents, medyo mahirapan naman tayo dyan. But at least yung therapist who would try, and I won't say na yung younger therapist because actually, baka nga yung younger therapists yung mas aware pa. I would say yung mga older therapists na not into the practice, not trained to using it, baka maka-help if they would have trainings regarding it or like a background on how you could use it or parang just setting the limit na okay, you can use it to generate something pero it's up to here lang because from here on na dapat you have to do it na or at least you have to do this as a therapist tapos from here on, 'di ba, the other way around, from here on you can leave it up to the chatbots or to AI na. Baka yung mga ganon, more information on how we can actually use it for the benefit of the client. So I don't have very specific answers because maybe I'm not familiar, but siguro as a possible user, that's what I can think of.
So would you say like in terms of continuing professional development, you'd want it to be more integrated into introduce AI like seminars, trainings, something like that? Yes, okay.
Yeah, I would be willing to attend seminars like that.
All right, so let's move on naman po to acceptance and intention to use AI in clinical practice. So, with everything that you've said, how did these experiences influence your perspective on generative AI's potential impact on the OT practice? So, I guess to make this question simpler, like how do you feel about the future of AI and of generative AI and occupational therapy?
I think it has high potential naman. Para who wouldn't want an easier approach to whatever we're doing, 'di ba? Para the promise of making things easier for you would always be promising naman in any profession, kahit hindi sa OT. So I guess, parang feasible naman siya or like it's something that I could be looking forward to. Tama ba? Na-answer ko ba yung question? Mhm.
So, would you say that you would want to continue using generative AI in your OT practice, or why not?
I would want to learn more about it so I can consider using it further in my practice.
All right, and then do you have any suggestions aside from like expound on what you said earlier on how we can prepare um not just the Filipinos, but more of the OTs, the Filipino
Mhm.
OTs for potential generative AI adoption. Like, how do you think we could prepare them to, since with the rise of AI, how could we prepare them to use it in their practice?
I don't know if it's being done already, but it would always fall on the curriculum of the undergraduates. Let's be honest, professionals, licensed therapists most of these licensed therapists would just attend seminars for the benefit, for the purpose of renewing our licenses, diba? That's something that we can't blame the therapists for. So it should always go back to the foundations. So foundation is undergraduate, of course, but still availability of workshops, seminars, parang being exposed to what's out there para mas ma-incorporate pa yun.
Do you find that you have colleagues who use generative AI technologies on the daily or have used them?
Well, on the daily, parang none in my clinical setting. Parang wala ako masyadong naririnig from them. But yeah, I've learned yung mga AI tools from colleagues naman yung sa visual impairment. The documentation, I think I've learned it from colleague also. So, uh, pero like yung circle ko, if some of them or I have colleagues working with me who has more knowledge, siguro if I can rephrase the question to that, baka wala. Baka of the same level, footing lang kami. So yung level of influence, neutral lang.
Okay, so for the last question, I guess in the future of healthcare as a whole, like how do you see it evolving with the increasing presence of generative AI?
Ah, ah. I would hope for it to make our lives easier nga. First and foremost, this is very personal, like ease of the documentation, if that's possible. Personally, I feel like okay naman ako with actual intervention, documentation yung problem ko. But if it would help me create treatment plans, di ba? Intervention assessment plans, ganyan. Why not? If AI would be able to help do interdisciplinary practice, why not? Diba? Something that would bridge the gap also. I feel like that's what's lacking in our practice here also. How could we maximize the services used by the client? So is it possible for AI to connect me to other professionals who would be able to help my clients? Siguro ganon. Is it possible for AI to create more interesting activities for my kids, for the kids that I serve? Baka ayaw na nila yung mga traditional pen and paper. That would be nice naman. So siguro mga ganon.
All right, so that's it for our interview naman po. So we thank you for your participation. So would you like to ask any questions or say anything before we end?
No naman. I'm good. I'm good.
All right, so for your confirmation, we'll be sending the transcription of our interview so you can check whether or not your answers were consistent with what we noted down. So I'll just pause the recording now po.